Good morning, everyone. Thank you for joining us today for week number 7 of our COVID webinar series. As always, please submit any questions that you have via the chat box, and we'll respond to them as time allows. Also, if you haven't had a chance to check out the recent edition of Frontline Heroes to our webpage, I encourage you to do so. You'll see that on the screen right now. If you'd like to submit a story about your frontline hero, please do that. You can click on that orange button at the top of the page, and if you want to read those shout-outs that have been given to the frontline heroes, just click on the button on the bottom right, and that will take you to a fastly filling up webpage with some great stories about what's going on. And with that, I'll turn it over to Val.
Good morning, everybody. Thanks for joining us today. We're opening up on the state is entering phase 1 of reopening our economy on Monday. I know that can be a little confusing. What does reopening mean? And we're going to talk through that a little bit. I kind of wanted to give you a little situational update first, though, on the numbers across the state, just so that you have some sort of idea. And we've shown you guys before, and there's access through all of our websites, but if you're really interested in the activity in your county or surrounding counties, your positives and testing, please go to the Department of Health's website. There's a link to their county map there. You can click on your county and see how many positives you've had. We've been in this for a while now, so what you really need to be thinking about and focusing on is how many positives have really been in the last 14 days. Because those are the decisions, how many positives in your community last 14 days really help make the decision on how we should be moving forward. So this is a very data-driven approach to reopening. It's very slow. I read today in the newspaper, I am one of those people that still gets a paper newspaper delivered to their house, and I read it every morning. But in Cole County, they had issued just guidance across the board, and one of the things that I liked, it was really clearly written. So if you've got questions about what's going on in your individual county, I highly recommend that you look to your county health department's website for their guidance also. For example, in Cole County, I'm also on a little park board, and our park said, oh, we're going to have a baseball tournament on May 15th, and I'm biting my tongue and squinting my eyes like, no, we're not, no, we're not. And Cole County issued guidance today that said, little kids could probably practice baseball as long as you can, do your social distancing, but please no tournaments until after May 31st. We want to keep large crowds down as much as possible. So it's just common sense thinking along those lines, and those local public health agencies are help pushing that kind of messaging out. With that said, I did kind of want to give you another update specifically about Buchanan County and that surrounding area. So if you're in the Buchanan County or surrounding area, there was an outbreak kind of associated with the Triumph food plant. But remember, it didn't start in the Triumph food plant. It started with employees that work at the Triumph food plant, but a lot of those employees have been tested. Actually, all of those employees have been tested now. There was 34 positives at the plant. Before Monday. On Monday, they tested 707 employees who had presented asymptomatically, which means they were not exhibiting any symptoms at all. And yesterday, they released that 92 of those 707 employees were also positive. So these are what we call asymptomatic positive people. And I think it's really important when you're thinking about planning for re-entering in the community that we remember that you can spread COVID-19 even if you don't feel sick. And so it's not because people are spreading it around and they know they're spreading it around. People do not know that they have it. So please, when you're thinking about how you want to re-enter the community, pay attention to these county numbers so that you know their impact on your ability to re-enter. They did test the remaining 1,500 employees at that plant, and those 1,500 employees' results should all be known by Saturday. So I'm sure all of that is very well documented in the press up there, but please pay attention if you're in Buchanan County or any of the surrounding counties, and this is going to cross state lines also. So again, the virus doesn't know borders, it doesn't know boundaries, it doesn't know anything. It just likes to stick with you and sometimes make you really sick and sometimes not. So stay tuned on that, but that kind of helps me get to the next part of what we want to talk about. And I know that we got a lot of questions in, which thank you. I'm not going to read them all, but I'm just going to read a couple of them about reopening and how we need to reopen. So one of the questions we got was, can we still have residential clients self-isolate? Many of our clients have significant underlying health conditions, and we don't think it's safe for them to re-enter public spaces. Heike, can I have you go to the Getting Back into Your Community, please, real quick? So we are going to post this today, but I wanted to kind of roll it out now for you all. We have a planning guide for you to look at. Individually, this is as much for families as it is for providers, as it is for individuals who can plan their own lives. But this specifically talks about, helps you understand if you're vulnerable or at a higher risk for severe illness from COVID-19. There's a box on here about COVID-19 decision-making, so questions that we know you're asking and ways to help you answer those questions. It's important to make informed decisions and do what's best for you. So make sure you openly communicate that with your healthcare providers, your staff, your family, your service providers, and support coordinators so they can all help you make informed decisions. If you go to the next page, Heike already did, how can I prevent COVID-19? Remember, these are things that we talk about all the time. Wash your hands, avoid close contact, still need to stay home as much as possible, and physically distance yourself from other people if you can. And we know for our folks, not everybody can physically distance to even handle their activities of daily living. So you've got to keep all of that in mind as you think about how people are going to re-enter the community. Cover your mouth and nose with a cloth face cover when you're around others. And again, I cannot drive this point home enough. You can spread COVID-19 to others even if you don't feel sick. And we know we see that happen. And then, cover coughs and sneezes. And last and most importantly is clean and disinfect. So wash your hands, but then you also need to clean and disinfect surfaces that are touched regularly. So I wouldn't want to go into a restaurant that doesn't clean the whole booth, table, chairs, everything, before they would let another person sit down in that booth. Those are the kind of things you need to be thinking about, especially if you're in areas that we are monitoring, that we see that there's a lot of community exposure. If you go to the next page, Heike, we talk about when deciding if you're ready to get back into the community, you have the right to say you're not ready yet, and that goes for our consumers. They get to say, I'm not ready to go back in. There's a lot of anxiety about re-entering the workforce. There's a lot of anxiety for us that have been in the workforce about having more people come into the workforce. So just keep that in mind. You also have the right to ask for change in services. If you need to make change to your plans, please work with your support coordinator, but then there's some additional COVID-19 considerations for you to think through, including your ability to communicate whether or not you have symptoms or feel bad or even understand what those symptoms are. And finally, the last thing I want to point out is kind of on the last page. Again, on this page, there is a link in that very top bullet to the Department of Health and Senior Services where you can go and see county reported cases so that you know what's going on in your county. Also, just remember that everybody is responsible, and that's really what we try to get across in this box, is that if you live with somebody who's at great risk, if you live with somebody who's over the age of 65, if you live with somebody who is going through chemo treatments for cancer, if you are living with those kind of folks, you are also responsible for their safety. It's not really just about you. It's about your community, and your community is at home, your community is in your neighborhood, your community is all around you. So please take into consideration your whole community, your whole intimate world, and then beyond that before you make decisions about re-entering. Finally, we've got some questions for home and community-based service providers. These are just ways that hopefully can help you guide that conversation. So we will be posting this today. Now, Heike, if I can get you to go to the Show Me Strong website, please. The governor's put out the Show Me Strong website, and we got a question specifically. I'm going to read this one to you. Sorry, I walked away a little bit. On Monday, the governor ordered a new set of guidelines as part of the first phase of the Show Me Strong recovery order. In Section 3 of the order, it states that members of a long-term care health facility are not to accept visitors until the end of the order, which will remain into effect until May 31st. The governor also stated in his speech on Monday that long-term health care facilities, nursing homes and retirement homes, and assisted living facilities stay-at-home orders would not be expiring until May 31st. Val has asked providers with ISL group homes to consider ourselves as long-term care health care facilities and should follow the guidelines and such. Does following these orders mean that individuals should remain in their homes until May 31st? Should our ISL group homes remain closed to visitors until May 31st? So I will tell you, as a provider ourselves as a state, we are not opening up to visitors at this time. We will be looking at a reopening plan to see how we could possibly phase that in. But right now, that is not something that we are going to be doing. I think you need to look at your county data before you make those kind of decisions. I think you should feel totally comfortable saying we're not good with visitors coming into the homes right now, though. So please don't feel like by doing that, you are violating something. I think you should feel totally okay with saying that right now. I do think you need, and this is one of the things that we're working on the state side, you need to start to develop a plan of what it looks like when you do think it's okay to let visitors into the home. Are you going to require them to have masks? Are you going to be providing those masks? How are you going to make sure that they've washed their hands? Are you going to limit touch opportunities? Are you going to meet in the yard? I mean, we are at a nice time of the year where we don't always have to be inside when we talk to folks. So just think through how you want to, and now would be the time to start thinking through how you as a provider would start implementing visits whenever you can start implementing visits. But as the state, as a provider also of both ISL services and group home services, we are not going to be letting visitors in, at least not starting this week. And we'll let you know our opening plans if that will help you guide your opening plans. So, and again, the Show Me Strong website, if you go to the businesses tab there, there's a click on businesses. It talks through a little bit, but if you go to the bottom of that guidelines part of that page, you will see that is where it specifically talks about people shall not visit nursing homes, long-term care facilities, retirement homes. So there is guidance out there. We'll also be posting guidance to this page today under citizens, and that guidance will specifically talk about what we've talked about in terms of people over age 65 and people that are vulnerable with specific health conditions and considerations they need to be making. So again, you really got to plan through this on your own. The other thing I wanted to point out on this website too, the Show Me Strong Recovery website, is in that resources column on that citizen side. Heike, if you'll scroll back down a little bit, please. Oh, yep. There is specific information about from the Missouri Department of Mental Health COVID-19 information and the disaster distress hotline, and then the Missouri Department of Mental Health self-care resources. So I wanted to point those out to people also. I mean, we've got those, your ability to access those in multiple places, but they're also now part of the Show Me Strong opening plan. So getting back into your community is really important, but planning for it responsibly and working with the individuals you support is also really important. There was another question about PPE. I know there are some struggles with that PPE Google Marketplace. There is an email for you to send your struggles to. That is Supply Solution. Supply Solution is all one word, at ded.mo.gov, and we will put that on the website today too so people can find that and reply to that. The last thing I'm going to talk about this morning is the budget and the revenue picture. Now that we've passed April 15th, when we would normally collect revenues, and we're not collecting those revenues because those revenues will now all be deferred to July 15th when people need to pay their taxes, which unfortunately puts us in the next fiscal year. We do understand that our revenue situation is not well. We've implemented expenditure restrictions that we think we need for this year. At this time, I'm not aware of any additional expenditure restrictions that we will need. But we also know that the impact of the economy, the high unemployment, all of those things, people not paying sales tax, all of those things will really start to show up in May and June in our revenue numbers. So we are planning right now, and the Senate actually today is doing markup on the budget. The House completed their budget work one day this week. They all kind of run together for me. Specifically for the division, what has occurred in the budget for next year, starting July of next year, is right now, and this is all still subject to change and won't really be known until we start the fiscal year on July 1. So I want to make sure people understand that. The governor will be monitoring the revenue situation all the way through July 1 before we know exactly what we're going to be able to do with our budget. So just because it may show up in there now doesn't mean it will stay in there on July 1. And we will not be making those decisions or making announcements about what we're doing until we know we can move forward with stuff. So our wait list funding to get rid of the wait list that we have accumulated right now is still in the budget. However, our utilization new decision item, which is what we use to prevent a wait list in the future, that is not funded. So What we are in the House position right now is basically keeping our wait list kind of where it's at, but able to move some of those folks that have been on there over the last year off of that wait list. So that's item number one. Item number two, there was funding in the budget to help our residential providers with their rates, to get their rates more standardized. That funding is not currently included in the House version of the budget. Also, there was some funding in the budget for providers of in-home services, your personal care services, to increase those rates. That funding is also not included in the budget at this time. Gary, is there anything else that I'm specifically missing?
Oh, some really small stuff.
There's some really small stuff that would affect some specific situations, and we won't go into those on this call, but we'll talk through those more with those specific situations. Which one?
The autism clinic.
Yeah. So no other cuts in the budget for July that we're talking about right now.
Nope.
Okay, sorry, we had to clear that up real quick. I think I'm going to go look at the computer now to see what's coming in, and I'm going to turn it over to Gary.
Okay. I'm going to go through a couple of questions we got about stimulus checks. One, the question was regarding ones received by consumers. A statement was made that they won't account against assets for 12 months. So what is the regional office going to do if the regional office is payee? Are they going to hold it? Or are they going to do recoveries on it? So that $1,200, the first thing we're doing is we're putting it into a savings sub-account to segregate it so we can hang on to it. It's going to be prioritized as the priority is always for the individual's needs. If there's additional room and board items, if their current benefits aren't able to cover room and board, then we may look at that. Our last resort is to use that for ResHab or for services to keep someone eligible. That is our last resort, and so we're going to be looking at other items first. So we still have yet to work with the regional offices on guidance if that that $1,200 if there's not a need for it. I think the most practical solution is to set up ABLE accounts, which the regional office cannot do that. It has to be a family member or guardian. So if for the $1,200, we may be trying to encourage more people to set up ABLE accounts. Also, a question was coming in about for representative payee the stimulus checks, how that money will be coming in. So people haven't seen it yet. So we've been monitoring it here, and I've just started seeing some checks come in certain regional offices, and are coming in as paper checks for individuals we're payee for. So there's we're just starting to see them come in. So if you haven't seen it yet, don't be alarmed. We're going to keep monitoring that to see how they come in, paper, electronic. So far, it looks like paper. And if there's anybody missing it. So we're just starting to see those come in. And then some success stories. So on Station MD, we keep hearing some things from the field. So we had CDD reported that they had an individual with a swollen knee. Wasn't sure if it was serious or not. They called Station MD and reviewed it, and Station MD said that person probably needs to get to the ER. So they, Station MD contacted the ER, submitted the information. The person was admitted fairly quickly because it was an issue that needed to be a hospital admission. It turned out to be a serious issue, but it was identified over the telehealth visit. The admission process was streamlined because they had received the information ahead of time. So that was a situation where medical attention was needed, and it was identified. So it's not just about avoiding the ER, it's about going there when you really need to. So that was good to hear. So if you have good experiences or if you have bad experiences, we like hearing them because we want to find a way to keep this service around, but we need to know how it works. So with that, I will turn it over to Angie.
Hey, good morning, everyone. Wanted to give you an update. We have seen some movement on our Appendix K. Earlier this week, CMS sent us some informal questions, and those questions and comments really asked us for further clarification, and they were also helpful in that they really guided us to the appropriate paths to request flexibility. So, for example, you've seen on our Appendix K that we asked for flexibility to suspend the requirement to access the community and suspend some of those requirements for allowing visitors at any time. CMS did indicate that the Appendix K does not have the authority to suspend those requirements because they are federal regulations. So they have asked us to redirect those requests for flexibility through the 1135 authority. Some other things that they had just kind of asked for clarification on, we had answered those. We made any of those necessary adjustments and clarifications, and we resubmitted that to CMS yesterday. So hopefully we will hear something soon on that. At the same time, since CMS redirected us on some of the authorities that we asked to the 1135, we've been working closely with MoHealthNet again, and we're working on a round 3 of the 1135 submissions. In this third round, we are going to include items from that Appendix K that needed to be moved over. And then we're also adding information and requests for our ICF-IDs. And so with the ICF-IDs, we've been working closely with MoHealthNet and Department of Health and Senior Services to include flexibility for specific federal requirements. And I don't know if we have many ICF, ID providers on the phone or on the webinar today, but I will go ahead and kind of go through those in case we do. Those regulatory requirements that we're asking to waive, they include waiving facility staffing requirements due to shortages that would be caused by COVID, asking to waive discharge requirements when the individuals are temporarily admitted on an emergency basis to ICF-IDs due to COVID. We're also asking to waive any required active treatment service plans for individuals admitted to this facility due to COVID. We're also asking to extend quarterly reviews by 90 days in the event of staffing shortages, and to amend quarterly evacuation drills to be allowed for the facility to announce them and simulate the drills. And then we're also asking for a temporary suspension of the visitation requirements in those facilities as well, similar to our home and community-based community providers. So I know, like I said, the K was submitted yesterday. Hopefully we hear back from CMS next week on that. The 1135 third round, we're continuing to work on that through MoHealthNet, and hopefully that will get submitted next week, but we will stay tuned to that. The other thing that I wanted to bring up with everyone is that we sent out a record review request from MoHealthNet this week, and it has caused a little bit of confusion. So I wanted to provide some clarification on that. Although our division asked CMS for flexibility with our division reviews through the Appendix K, MoHealthNet has not asked for any flexibility on their reviews of our program during COVID. So they plan to continue with the record reviews. Those record reviews apply to all TCM entities and our state support coordinators that fall within MoHealthNet's random sample pool. So I know that TCM entities and regional offices are already working on that, so we really appreciate your work on pulling those together. You will notice that the dates look a little different, and they're trying to make it a little easier. They're going back to quarterly reviews instead of doing annual reviews. And really, it's going to be the same amount of reviews that we've done over the full year. They're just dividing them into 4 quarters. So if you have any questions on that, feel free to reach out to us or your regional offices, and we can help you through that. We received a question about individuals not being able to go out into the community, and if that will be a problem for providers later, and what type of documentation would be needed. So we just kind of want to reiterate that going out into the community is based on an individual's needs. And again, following that guidance really that Val kind of showed you on our website earlier, use that. And again, it's on that individual's needs, kind of where they're at, where they're standing, where their residential services, where their whatever service they're receiving, wherever that's located, and how that impacts their lives. If an individual is scheduled to go into the community for any service, but they're not able to due to COVID, that's okay. Just make sure your documentation, you handle it in the same way as if the person chose not to go out, or if they were sick and decided not to go out. That documentation process would not change due to COVID. So with that, I'll turn it over to Kim. Thank you all.
Thanks, Angie. Good morning, everyone. Just wanted to share a few quick kind of things to consider. There's so much information right now that it's just really important for everyone to just kind of take a moment and consider some things to ask yourself, maybe a few questions that could support your efforts. as you're looking to mitigate your risk of contracting or spreading COVID-19. And one good thing to take a moment and think about is what's the area that you're really needing to further educate yourself regarding. So for example, is it specifically around monitoring? Is it around disinfecting? Is it around PPE? You know, you can kind of slice that several different ways on kind of focusing on a specific area. And then also, who does the information need to apply to? So for example, is it you're looking for information to apply and implement to support yourself and your family? Are you looking for information to support you as an employer in regards to your employees or the services that you're providing to individuals that we support? Because there's lots of different information that is geared towards those specific areas. Hopefully taking a moment and kind of thinking through and helping you to narrow your focus, it won't seem so overwhelming right now. And we do have a lot of information like we've shared today and that we continuously are posting out on our website, and things do change on a pretty frequent basis. One good example of an area is around cleaning and sanitizing related to coronavirus. When you think about that, you again could look at it from your own personal household, or if you have a facility that you're operating, or if you have a specific business like a day program. And so again, we have posted information from CDC and DHSS and other great resources. We have a great, fairly brief YouTube video from DHSS that really kind of speaks to supporting these efforts as well. So hopefully those are some helpful tips. Another important thing to consider right now is to make sure that everyone's taking time and kind of discussing about how you're feeling in relation to everything that's happening around COVID-19. Obviously, there's been a lot of changes in our daily routines, our ability to access our communities, and even our ability to spend time with friends and family. We had a really great example, I think, that was posted recently on the importance of this through our success stories. And it was about an individual whom everyone really thought was really struggling and having difficulty with following the stay-at-home orders and the guidance. Just kind of really struggling with that, not staying in, going out. And after there was further discussion and really listening to the individual, it was found that what they were really struggling with was that they were wanting to live somewhere else. And so then the team kind of sat down and started working with the individual to support them on some other options for places to live. And so I think that's just a really great example of the importance for us all just to kind of pause, take a moment, and really share our feelings and communicate with each other to help each other get through these challenging times. And then lastly, I just wanted to share, added to the information that Val shared at the beginning of today's webinar, with that memorandum, we're also posting a tool that you'll hopefully find helpful, and it's optional, but stressing the importance of emergency backup planning. Emergency backup planning is important ongoing as part of planning for all of us to mitigate risk, but especially right now with COVID-19, it really supports our efforts to think about, in the event that if we're relying on someone to support us daily through caregiving, if they were not able to do that, what's our backup plan? Who would step in and be able to support us? So again, hopefully you'll find those resources very helpful. And I see Heike has it pulled up on the screen now. So, and again, your guys' feedback and input is so vitally important to us within the division. Please let us know if you have additional thoughts or additional resources or tools or information that you need so that we can hopefully help support you during these challenging times. And so with that, I think I'll turn it over next to Wendy Witzig.
Good morning, everybody. I'm going to spend a little bit of time today just talking about the hot topic, it seems to be, is the day programs and what things we need to think about and considering around opening day programs. Wanda Crocker and her team have been working on pulling guidance together that we will get out probably in a draft format later this afternoon, but we want you to see what we're working on, because we also want you to be a part of helping to form it and guide it. So give us some feedback on that. So I'll be working with her later today to make some updates to it, and then we'll see to get it out. But basically what we're wanting to do is to kind of lay it out in the framework that makes us think along the federal guidelines and structure as well as the Missouri structure, and then taking into account the things that Val talks about and looking at and needing to know your county data in terms of just the presence of the virus and all of that. But I'm going to start off with, I think the very first thing that we need to just understand and realize is that day programs are going to look different in the future. When opening up day programs does not mean that they're going to resume business or look the way they did on January 2nd when you opened up after the new year. So I think we need to start with an assessment of just the folks that you've got in your program and the partners that you support in terms of families and residential providers, and doing an assessment with them about where are they at right now in terms of feeling like comfortable in coming back, desire to come back. What is that going to do to your changing census? There may be some folks, everybody's going to be missing their friends and may want to come back, and then you're going to have some other folks that may not want to return to a day program, and so your census may look very different. So to the extent that you can assess that as early on as possible, I think will be helpful, and also assessing your staff and where they're at also in their comfort level in returning to work, and assessing, how you're going to be able to support people. From there, I think you're looking at if you have a day program location, you have a congregate setting. Of course, we have to abide by the governor's rules around not a group size of 10 or less, and so that includes staff. So how can you organize your day program space in order to accommodate those social distancing requirements? And then also, maybe how do you accommodate your schedule? Maybe it's not a 9-to-3 schedule anymore. Maybe it is you have an evening schedule and a daytime schedule, or there's a blend or an overlap, or there's more half days and then full days or something like that. We're also looking at, consider about how you stage things in. So right now you're in phase 1 and you're looking and planning about what your space looks like, how many people you have, what are the needs of the people that you're supporting. So some people who are more compromised, maybe physically or medically, might not be good candidates to return to a day program. On the other hand, they are also more easily to social distance or create social distancing with. So those are all considerations that you're going to have to take into consideration with the people you serve, and it's going to have to be a team decision. So parents and residential providers are also going to have to be comfortable with these decisions and moves, and understanding how you're going to protect people once they come back to the center, because they're going to be bringing people back into their homes and back into the family home. So there's got to be a lot of reassurance and conversations around those kinds of things. You might look at ways to do things outside in the park or an open air area where you can easily social distance and have just the benefits of the sunshine and the open air with you in part of your protection, and then look later at staging and bringing people into a center in a more congregate setting. That might be another consideration. Consider your community integration activities. Swimming might be an easier and safer activity to do with the chlorine in the pools and all of that than another activity where you're in a sewing club and there's more people confined and closer together. So just be looking at your activities, how you might stage them in, what you might do to include people in different ways, and just what your day program might look like in the future is not likely going to be what it looks like today. A lot of folks are also talking about telehealth and have questions about doing that. A lot of people have expressed some success in working with the telehealth and are hoping that that can continue on after the COVID-19 emergency. And I think that the answer to that would be absolutely. We want to look at any of these practices that have evolved during this time period and have been effective, and how do we continue those in a way that's really meaningful. We don't want to necessarily go back to business as usual if business today, the way we're doing business today, is better. So, let's take a look at that. I would like to set up a couple calls where we can talk about telehealth. We've got some people that are using it for employment and also, I think, for some behavioral services. So I'd like for us to talk about telehealth in general and learn from you how you guys are using it in those different service settings. But then also maybe have some other calls where it's just day program providers. I know that there's an interest among day program providers to talk amongst each other about how they're using it and what bumps they ran into and just how to streamline that. So we'll be setting up some calls to do that and figure out how we include that in our next waiver renewal along those lines. So again, it's just individual planning. Look to your families, your teams, and your partners in the community, and we will be posting some other guidance out there this afternoon for you to begin to take a look at, and we'll look for your feedback on it.
All right. Oh, wait, are you done? She pointed to me. Okay, she's done. All right, thank you, guys. We're not done, so don't hang up yet. Just wanted to give you an idea. We have about 635 people on the call today, so once again, thank you so much for your continued interest and dedication, your interest in learning as much as you can, your dedication in helping us make our materials as good as possible, and then, of course, just keeping people safe in the communities. I wanted to make sure that you guys understood the documents that we're posting today on getting back into your community for individuals around planning and on providers. Please send us your feedback on what's working in those documents and what's not, and what's the questions we're missing, and what's the avenue that we aren't thinking through. I just got one on my own email about mask usage. Could we find something around how do we really gauge if an individual can use a mask? Because we know a lot of people will just let it stay on their face, but how is that affecting their breathing and those kind of things? So we'll start to work on those. So please keep those questions coming to us so we can help research how to get that information out to you. Another question we got that came in on the webinar was about antibody testing. And yes, we love antibody testing. There's really not a lot of good antibody testing out there right now, but we will make sure that we're part of any conversations around antibody testing in the state, just like we're making sure we're a part of any conversations around testing with the state. So I wanted to keep that in the forefront. And then the other question I got that I want to address, there's some more and we'll get those addressed in the FAQs, but individuals returning to work, both in the community and the workshop. So we already know right now we have individuals working in the community that are getting waiver services and that are supported by folks. So as long as they're able, and again, that's why you've got to look at that planning document, as long as they are able to successfully work in the community and successfully and can be responsible if they've got roommates around how they interact with their roommates. I mean, that could mean that when you get home from work, you have to change your clothes and take a shower, and you might have to stay in your room the rest of the night. I mean, those are some things, or switch back and forth. But those are some things that you need to think through as people are thinking about going back to work, whether that be in the community or the workshop. I mean, again, this is very individual. Re-entering the community is very individualized, and you really need to be thinking through that. Before we go, though, I wanted to pass it over to Director Mark Stringer. He's in the room with us today also. And I don't know how many of you caught his he was part of the governor's press conference on Wednesday, but I'll turn it over to him because I'm going to steal his thunder.
Hello, everybody. I just wanted to pass along that after the press conference on whatever date it was, Wednesday. After the press conference Wednesday, the governor was talking to several of us cabinet members who had been there. And, you know, one good thing that has come out of all this is that the governor and his team have gotten a better understanding of the Department of Mental Health and the challenges that we face. And at one point, the governor turned to me and said, Mark, I know that your folks face some really tough situations, conditions. And he said, when this is all over, I'm going to get out and thank them personally. So I think he doesn't know, of course, how many of that visits that would be, but he said, would you please pass along to your employees and your contractors how much I appreciate what they are doing in this situation. So I'm just taking this opportunity to do that now and to thank you myself for all that you're doing. I know it's a real struggle out there, and we will do everything we possibly can to support you. So with that, I'll turn it back over to Val.
All right, thank you. I don't think I can top it. So thanks again for your involvement today. Thanks for everything that you're doing, and we'll keep helping you help the people we support. Bye.